So hi everyone, welcome to the module on study designs. In this module, we will be discussing various types of observational studies as well as interventional studies. So what types of studies designs we will cover? We will cover cohort studies, case control studies, cross-sectional studies, randomized control trial, case series and case reports. Okay. So let's start with what is an epidemiological study and what is an interventional studies. So, in epidemiological studies, researchers examine the association between exposure and outcome in the real world. Okay, but in interventional studies, interventions are tested in controlled conditions. Say, for example, hospital, clinic, or institutions. So, in this type of study, epidemiological or observational study, we just gather the data from the real world. Okay, we don't go to the hospitals or enroll patients or anything like that. But in interventional studies, we enroll the patient in hospitals or clinics and give them interventions. Okay, and then we collect the data. Okay, we will discuss more about that in the later part of this video. So data is collected from real world population in epidemiological studies, also called observational studies, and data is generated after giving interventions in experimental studies, okay, also called interventional studies. So if we are conducting the study in real world, in the real population, do we have any control over the exposure? No. So no control over the exposure in epidemiological or observational study, but researchers can manipulate the environment and control the exposures in interventional studies or experimental studies. So as we have already discussed, epidemiological studies are conducted in real world population and interventional studies are conducted in hospitals or clinics. And because observational studies or epidemiological studies are conducted in real world, they have a high real world applicability. And interventional studies or experimental studies have comparatively low real world applicability as compared to epidemiological or observational studies. Okay. So we will start with the epidemiology studies or observational studies. There are three types, that is cross-sectional studies, cohort studies and case control studies. So let's discuss them one by one. So what is the cross-sectional studies? Cross-sectional studies are also called prevalence study because they measure the prevalence. Okay, they cannot measure the incidence. So what are these? These are merely the snapshot in time. Means you will collect the data from real world population in present. You will not go back in time to check for exposures and you will not go forward in future to see if the disease develops. So you will just collect the data as such from the real world population in the present. Okay. So these kind of studies, patients are not followed up over the period of months or years, and disease under the study and risk factor or exposure are studied at the same time. Okay, and you will try to make an association from the data gathered about the risk and the disease. So what we measure from such type of studies, we measure prevalence. Okay, we cannot measure incidence. Why? Because we are not following up with the patient over a period of time. So we will never know when the patient has developed the disease. Okay, and incidence means that how many patients develop the disease, how many people develop the disease over a period of time. Okay, so we cannot measure incidence, we can only measure prevalence, right? So because we are just gathering data from the real world population, we don't need much resources, we just want to gather the data. So that means cross-sectional studies are very cost effective and time efficient, and we can collect the data for multiple variables from the population. Okay, so you just need to gather the data, so you don't need much resources and you can gather the data for multiple variables. So it can be useful for hypothesis generation, and it is ideal for public health planning because you just gather the data, make an association between the risk factor and the disease, and you can generate a hypothesis and you can also plan for public health accordingly. Okay, so this diagram tells you the difference between a cross-sectional studies or longitudinal studies. So as we have already discussed, in cross-sectional studies we gather the data only from present. Okay, and in longitudinal studies we take the data from the past, future and as well as present. Okay, so that is the basic difference between the designs of cross-sectional studies versus other longitudinal studies. Okay, so we will discuss the longitudinal studies in the later part of this video, that is cohort studies or case control studies. Okay, so example of a cross-sectional studies. So people living in Texas are surveyed to determine whether they eat junk food and whether they have any chest pain or not. So are we going back in the past to check for the risk factor? No. Are we going forward in the future to see if the patient has developed a disease? No. What we are merely doing here is gathering data from the population at present. So part of group is being studied, not followed up over a period of time, and prevalence is being determined. So 30% reported intermittent chest pain. So that means there is 30% prevalence, 30% prevalence of chest pain at present in the population, right? So that is prevalence. So in cross-sectional study, we don't follow up with the patients over a period of time. We don't go back in the past to check for any exposure or risk factor, and we determine prevalence. So that is why you can identify, that is how you can identify that this is a cross-sectional study. Another example. Researchers believe that there is more prevalence of disease X with certain gene, and they screen 1,000 patients for the disease. And they also do karyotyping for the said gene to check for association. Again, we are not following up with the patients over a period of time. We are not going back in the future. We are not going back in the past, and we are determining the prevalence. So this is another example of cross-sectional studies. Coming to cohort study. These studies compare a group of exposed individuals to an unexposed individuals group to determine if the outcome is associated with the exposure. So let's discuss the study design. We take the cohort of a patient. What do we mean by cohort? That is a part of population with certain characteristics, and see how many are exposed and how many are not exposed. So let's take an example of smoking and lung cancer. So we will take the cohort of patients, say youngsters in a particular age group, and we see how many of these patients smokes and how many of these patients don't smoke. We follow up with these patients over a period of time and see how many individuals in the exposed group, that is smokers, develops the disease, and how many patients in the unexposed group develop the disease. Similarly, we will see how many people in the exposed group, how many youngsters in the exposed group don't develop the disease. And similarly, we will see how many youngsters in the non-exposed group don't develop the disease, and we will gather this data. Okay. So what we can determine here? We can determine relative risk. I will discuss that. So first, exposure is determined in a cohort study, and then outcome is determined over a period of time. Okay. And there are two types of cohort studies: prospective cohort study. So the design we discussed here is a prospective cohort study. Okay. What is a retrospective cohort study? So in retrospective cohort study, we take people with certain disease, okay, and we go back in time to check how many of these people were exposed or not exposed. Okay. So in retrospective cohort study, we go back in time. In prospective cohort study, we go forward in future. So that is the basic difference. In both these studies, we are comparing exposed versus non-exposed. That is, patients with a risk factor and patients who don't have a risk factor. Cohort studies are used to study common diseases. Okay, they cannot be used in rare diseases. Why? Because suppose you take a cohort and you categorize them as exposed and non-exposed, you follow them up over a period of time, and nobody develops a disease, because this is a rare disease, right? So if nobody develops a disease, whole your effort in terms of time, money, resources during this follow-up period will go waste. So because we don't know in case of rare diseases that how many people will develop the disease or whether anybody will develop the disease or not, we will not do cohort studies in case of rare diseases, because they are very costly and time consuming and resource consuming as well. So what do we determine from cohort studies? We determine relative risk. What is relative risk? Incidence of disease in exposed group divided by incidence of disease in the non-exposed group. So see here, this is the exposed group, this is the non-exposed group. So what is the incidence of disease in this exposed group divided by what is the incidence of disease in this non-exposed group. That is relative risk. Let's see with a simple example. So suppose 50% smokers get lung cancer within 10 years and 20% non-smokers get lung cancer within 10 years. Okay. So this is the incidence in the exposed individual and this is the incidence in the non-exposed individual. You divide these two numbers and you will get the relative risk. So in this case we are dividing 50 by 20. So we will get 2.5. So that means relative risk is 2.5. Smokers have 2.5 times more likely to have lung cancer. This is what relative risk tells us, that how many times exposed individuals are more likely to get the disease as compared to non-exposed individuals. Okay. So if you want to see more details on relative risk, you can go to my risk quantification video and I have discussed that in more detail. Everything, relative risk, attributable risk, etc. Okay. So let's take an example to identify the prospective cohort study. We take 50 smokers from California who are compared with 50 non-smokers from California itself for the period of 10 years. So what we are doing here, we are taking 50 smokers, that is exposed individuals, and we are taking 50 non-smokers, non-exposed individuals. We are following them up over the period of 10 years and for the risk of lung cancer development, and we are measuring incidence. Okay. So that is a design of a cohort study as we have discussed before, and we measure incidence from cohort studies because we are following the patients over a period of time and certain people can develop the new disease, so we can calculate the incidence. In retrospective cohort studies, we take 100 new yorkers who smoke and were identified based on a screening questionnaire at a local hospital. So these patients were compared to another group that reported no smoking, and then hospital records were analyzed going back 5 years. So here we are going back 5 years and we are taking non-exposed individuals and we are taking exposed individuals to a particular risk factor and going back in time to collect this data. So this is an example of retrospective cohort study. What is common in both prospective and retrospective cohort study? We are comparing exposed people with non-exposed people. So this is common in both the cohort studies. So that is how you will identify whether it is a cohort study or not. So if exposed individuals are compared with non-exposed individuals, it is a cohort study. But how will you know it is a prospective cohort or a retrospective cohort? So if the patients are followed up in future over a period of time, that is a prospective cohort. If you are going back in time to check the hospital records and to check for the risk of exposure, etc., that is a retrospective cohort. So what is a case control study? Case control studies compare individuals with a specific outcome or disease to a similar group without the specific outcome or a disease. Okay, so we are comparing cases and controls. That is why it is called a case control study. Okay. Sorry. So in cohort studies, we were comparing exposed individuals with non-exposed individuals. But in case control studies, we are comparing diseased individuals with non-diseased individuals. That is cases and controls. Okay. So case control studies, after categorizing non-diseased and diseased individuals, look back at the past to determine and compare the prevalence of potential exposure factors between two groups to find associations. So you may confuse this with a cohort study, a retrospective cohort studies, where you also go back in the past to check for exposures. But there is a difference. Here we are taking diseased individuals and non-diseased individuals and going back in the past to check for a particular exposure, that how many diseased individuals had a particular exposure, how many non-diseased individuals had a particular exposure. In cohort studies, what we are doing, we are taking a group of diseased individuals only and checking how many of these patients had exposure and how many of these patients didn't have that exposure. So that is the difference. We will discuss that again visually, don't worry. I have a diagram in the later part of this presentation and we will discuss that. So we can use case control studies in rare diseases. Why? Because we are starting with the disease. Even if the disease is rare, You can collect 100 or 200 patients of that rare disease, and you are sure that you can go back in the past and check for exposure and non-exposure for the risk factor of interest. So you are okay. But in the cohort study, you are following the patients up, following the non-exposed and exposed individuals in the future. Okay, and you are not sure whether the disease will develop or not, because disease itself is rare. So that is why we use case control study in the rare diseases. What do we measure? We measure odds ratio. What is odds ratio? That is chances of exposure, chances of patients being exposed in the diseased group divided by chances of exposure in the non-diseased group. I have explained that in more details in my risk quantification video, so you can go and check that video. We can study multiple risk factors or exposures in case control studies, and they are quicker and less expensive as compared to cohort studies. Okay. So this is the design of a case control study. Sorry. So you take diseased individuals and you take non-diseased individuals. You go back in the past in both these groups to see how many of the non-diseased individuals were not exposed to the risk factor and how many were exposed to the risk factors. So this should be actually exposed. Okay. So I am sorry about that. This should be exposed. So we take diseased individuals and non-diseased individuals and we go back in the past to check how many of these patients were exposed or not exposed in both the groups, and we compare the rates of exposure and we try to make an association by using odds ratio. By the way, relative risk is a better measure than odds ratio, and I have again discussed that in my risk quantification video. So let's take an example of case control study. A group of 100 New Yorkers with lung cancer were identified based on screening questionnaire at a local hospital. These patients were compared with another group. So what we are doing here, we are taking patients with the lung cancer, we are taking patients who don't have a lung cancer. Okay, so we are comparing diseased with non-diseased individuals. Both groups were questioned about smoking. Both groups, diseased and non-diseased, were questioned about smoking. So we are going back in the past to check who smoked and who don't smoke in both these groups, diseased versus non-diseased. And we will check the prevalence of smoking, okay, and lung cancer. And we will try to make an association by using odds ratio. Okay, so that is an example of case control study. So as I have promised that we will discuss these designs of study again visually. So here it is. So in cross-sectional study, what we are doing? We are comparing we are gathering the data about the risk factors and the disease prevalence, and we are trying to make the association. We are not going back in the past, we are not going in the future. Okay. In case control study, we take patients with disease and without disease, like without disease, with disease, and we compare the risk factor frequency. Okay. Of like we see a particular risk factor of interest and check the frequency of that risk factor. In retrospective cohort study, what we will do? We will take only the diseased population, and we will go back in the past to check that who had the risk factor and who didn't have the risk factor, who had the exposure or who didn't have the exposure. So we are taking only the diseased population in cohort study, but we are checking we are comparing exposed individuals with non-exposed individuals. In prospective cohort study also, we are comparing exposed individuals with non-exposed individuals, and we are going forward in future in prospective cohort study. In retrospective cohort study, we are going back, right, to check the hospital records or any other records. So that is these are the basic designs of observational studies. Okay. Now how will we identify different types of study, different type of observational studies? I just wanted to reiterate this. So retrospective cohort studies versus case control studies. In cohort studies, you will see two groups, exposed and non-exposed. Case control studies, you will see two groups, disease versus non-diseased. Okay. Cross-sectional versus case control studies. So cross-sectional studies don't go back in time and don't go forward in future. Okay. Cross-sectional studies, we collect the data only from present. It is a snapshot in time. Case control studies go back in time. Okay. So coming to interventional studies. Randomized control trials. Okay, randomized control trial is a type of interventional study because you give intervention. They are conducted in controlled environment. You don't gather the data from real world population. Okay, it randomly assigns participants to the intervention group or a control group to test for the effectiveness of intervention. These are the studies which are done to see the effectiveness of new drugs that are being developed by pharmaceutical companies. Okay, just to give you an example. So they test the effectiveness of intervention by assigning participants to the intervention group or to the control group. So that is the basic definition of randomized control trial. Advantages: it is a gold standard for affecting the cause and effect relationship, okay, and effectiveness of new treatment, I have already mentioned before. So it is very important to minimize the bias in such kind of studies. Why? Because first they are being conducted in a controlled environment. So that means there is a lot of chances that there will be bias, right? So we want to minimize the bias by randomization or by allocation concealment or by blinding. So we will discuss that. And it establishes these kind of studies establish the causality. Causality means that like whether the drug is effective or not, basically, right? So it establishes the causality between the new drug and the effectiveness. Disadvantages: RCTs, randomized control trials, can be very expensive and time consuming because you are creating a controlled environment. These are conducted in the hospitals by enrolling patients, and they test the effectiveness of new drug. So you have to develop the protocol, you have to enroll the patient, you have to compensate the patient, and you have to conduct these trials across the globe. Okay, because you want to generate the data from across the globe, from various countries, so that you can market the drug in various countries. Okay, so these are very costly and time consuming, and there is a lot of participant attrition, that is participant dropping out of the study, and this can unbalance the groups and skew the results. Okay, so they can ask you the question that if there is a lot of participant attrition of the and lot of loss to follow up, how will you analyze the data? Whether you will consider the data of loss to follow up patient, or you will not consider the data of loss to follow up patient. So the answer is you will consider the data because the inbuilt design of the study. Okay, you cannot just ignore the data of the patients who are lost to follow up and analyze the data of patients who are not lost to follow up or who continued with the trial. There are a lot of ethical considerations again because this is a controlled environment and there can be a lot of bias, and patient safety is at risk because you are giving a standard treatment or a placebo or no treatment to the control group although you have a new treatment available. Okay, so that is why there are ethical concerns about withholding a potentially beneficial treatment from the control group. So these are the disadvantages of randomized controlled trials. So how will you prevent bias? By randomization, allocation concealment, and blinding. What is randomization? Randomization means you don't give the drug or treatment. Like you don't assign the patients in a particular pattern. You assign the arms, basically the new treatment and the control group, in a random manner. Okay, so participants are assigned to the treatment or control group purely by chance, ensuring that each has an equal probability of being in any group. So if we are not assigning the patients in a particular pattern, then researchers will not know that what drug, like what patient is getting the drug and what patient is not getting the new drug. Okay, so it prevents selection bias. How? So if I am a researcher and I know that every second patient will get my new drug, so will I not choose healthy patients for that particular arm? So suppose I know that first patient will get my new drug. I will choose an already healthy patient for that particular. I will choose a healthy patient as the first patient who comparatively has less morbidity, who is not suffering from any other disease, right? So that's how randomization prevents selection bias. Because if I don't know that first patient will get the treatment or first patient will be there in the control group, so I cannot select basically any healthy patient for my drug. So that is how randomization prevents selection bias. Allocation concealment means that we hide the treatment being given, hide the information that which patient is on which arm from the researchers. Okay, So allocation concealment is crucial for protecting the randomization process before the participant is assigned to the group. Blinding, it is a process of keeping participants or the healthcare provider or the outcome assessor, that is data analyst, etc., unaware of the assigned treatment after allocation. So there are three types of blinding. In single blind, only participants are unaware of their assignment. In double blind studies, participants and the investigators, that is healthcare providers or researchers, are unaware of the uh, unaware of the treatment being given to the patients. In triple blind, participants, researchers, and data analysts all are unaware of the assignments. So, if triple blind, everybody is unaware, there is very less chances of bias. So why we will do single blind studies? So we can do triple blind in all the studies, and we will reduce all the bias. So the reason is that some diseases are life threatening. There is more risk of adverse event happening. So if we don't know, if everybody is unaware and nobody knows what each patient is getting, then it will be very difficult to manage the adverse events. So in morbid conditions, in morbid diseases, say in oncology trials, it is sometimes beneficial to keep only participants unaware of the assignments, but researchers or data analysts should know that what each patient is getting. So if adverse event happens, they can successfully manage that. So that is what it is. Coming to case report. Case report is a detailed account of a single patient diagnosis, treatment or follow-up, and it describes a novel or unusual clinical scenario which can help in recognizing a new disease or syndrome. So what does that mean? It means that suppose you are sitting in an OPD and you see a patient and you find something that you have never seen before. You want to share this new finding with the world. So what you will do? You will publish a paper, send it to a journal, and journal will publish it, and rest of the doctors can read it. So that is a case report. Okay? And it can involve findings from one or at the most three patients. Right? So if you see more than three such patients and you want to write a series of case reports, that is called case series. Only difference. Okay? So a series of case reports involving patients who receive similar treatment or have a common characteristic, that is a case series. It is a series of group of case reports, and it provides a comprehensive information than a single case report and can be used to study rare diseases and develop hypotheses for larger studies. Okay. So because case series involve multiple patients, we need to have a institutional review board. It is considered a systematic investigation. Okay. So because there are multiple patients, we need an institutional review board. So what is an institutional review board? It is a kind of committee associated with every hospital. Okay. So it takes care of the safety aspects of patients, that patients are safe during the clinical trial or research, and it takes care of the ethical concerns. So it is a committee which ensures that patients are safe in the hospital, patients are safe in the clinical trials, and it also ensures the ethical concerns, that standard ethical practices are being followed in the hospital. Okay, so that is from my side. And if you like my content, please like, share, and subscribe. And more importantly, if you want me to make videos on any particular topic, then please let me know in the comments. And or if you have any feedback for me, please let me know. It will help me grow. Thank you.